One of the most common conditions my brother and I treat is ocular surface disease. And that includes three categories: dry eyes, blepharitis or eyelid disease, and allergies, which is very common, especially in upstate New York. It's important that the patient get evaluated by the physician to know exactly what's going on and what the cause of their condition is. Complaints that might be brought to our attention are tearing, excessive tearing after reading the computer or riding in the car with a defogger on or reading a book for a while, a foreign body sensation as though there's something in the eye, burning. Burning is a very common complaint, and this gets worse in the wintertime in upstate New York. Cold, dry air in our house tends to exacerbate ocular surface disease. Allergies are treated one way with antihistamines and sometimes steroid eye drops. Sometimes we do allergy testing on the patient. Dry eyes have a number of treatments. Most commonly artificial tears, which we typically start off recommending 4 times a day. If that's not adequate or the patient has a deficiency in their tear film, sometimes we place them on a medication to help them make more tears and a healthier tear film. If the eyelids are involved, sometimes we'll recommend treatments for the eyelids to help the oil glands in the eyelids function better. Omega-3 fatty acids are now being used to help the patient make a better tear film. Lubrication is always the mainstay. There are a number of other medications that we use. An examination is necessary for a number of reasons. We're going to look at the tear film. We're going to look at the surface of the eye, the health of the eyelids, and whether or not the patient has allergy-type symptoms. In contact lens patients, this can be a pretty significant problem. And if we're going to do surgery on a patient, we always want to evaluate the status of their eye surface to see if dry eye may make their recovery slower and to see if we need to be a little bit careful about proceeding and whether we start them on lubrication ahead of time.